Egbawaho, what is spiritual about intersex or ambiguous genitalia? Yeah, it's a very rare condition that you don't get to hear about it. But there's nothing spiritual, there's nothing witchcraft about a young child having the male and female genitalia. That's why we don't use the word hermaphrodite again, it's an obsolete word. Hermaphrodite is when a plant or a worm, lower animals, have both male and female reproductive organs, complete sex. So, but in a human being, we have been able to find either ambiguous genitalia, the external is only one that's confusing. Inside, the person maintains a particular sex. Or talk of chromosomal abnormalities, Klinefelter syndrome, where you have XXY, 46XXY. That tells you that such a person have a chromosomal abnormality during formation of the baby, which is not the fault of the man, not the fault of the mother, and not even the fault of the so-called child. It's unfortunate. Look at that video. Unfortunately, that somebody is beginning to see the girl as a witchcraft, and somebody is now laying hands to pray. Pray for what? Something that's purely medical. It can be hormonal abnormality. That's what's called congenital adrenal hyperplasia, or you have androgen insensitive syndrome. Any of these two are hormonal problems that occurs in a baby born with those abnormalities. When that happens, such a child has male or female organs. Sometimes the other one may be rudimentary, not well developed, while the other one is well developed. Sometimes both of them are well developed. That's what we call something called ovotestis. She has ovarian tissues, she has testicular tissue, meaning that she can ovulate, she can actually get pregnant, she menstruates. Meaning that she has penis, she can actually also impregnate somebody because sperm production is occurring. But these are very rare situations. In most cases, it is usually ambiguous genitalia, whereby the internal maintain maybe female, or the internal maintain a male, but outside it maintain another sex. That name will ring in your mind. James Johnson. He used to be Iyabo Abade, who used to be among the Nigerian female footballers, until it was discovered that no, she's only having the feature of a woman, but in real terms, she has actually a man inside, and eventually transitioned to what is called James Johnson today. So it's not in any way a surprise that the child can be. So what's the way out of this issue? In an embryological challenges where a child is born in that form, we will need to talk to our doctor's colleagues, our matron, our midwives, and the health workers generally. When a baby is born, the normal thing is for the doctor to examine this baby from head to toe. You want to discover in the head, is there any abnormality in this part of the brain or the head or at the back? You want to check the neck, is there an abnormality? You want to check the eye, is it normal eye? You want to check the nose, the head, the hole in the nose, is it normal? You check the fingers, and you have what's called extra digits. So when you begin to see things like that, you suspect. You listen to the baby's heart to know whether the baby is having normal heartbeat. All those abnormalities is what you will examine. You can check the abdomen. Is it having what's called omphalocele or gastrocystis? Which of them is abnormality that you can see in the tummy? Then you go to the perineum. Is it having a male organ or a female organ? Because the clitoris in woman is as good as the penis in men. So rudimentary, human being is growing like a woman from the beginning. The hormonal changes is what convert everybody that are male to male. For those that have an arrest in the process of conversion, they end up having the two. Now it depends on what has developed inside and what's developing outside. So do not take your child as a witchcraft and do not confuse them to be a special being. They're just like any other human being who will need to see a doctor and could go through surgical procedure after testing which of the two organs is prominent and which of them is weak. The weakened one will be killed, while the prominent one will be developed through some medication. The rudimentary one will be excised away through surgery. The major one will be given medication and develop well. So with that, the person will grow normal life and have normal reproductive system. After giving birth to your child, check the perineum when you can check well. When these children become like 5, 6, they begin to hide, they don't want to look at it very well. Check when they are 0 8 to 2 weeks to 3 weeks, confirm the kind of sex organ they have so that you don't become labeled as a witchcraft in the society.